We're just a few days away from a possible phase 2 opening, so perfect time to check back in with Upstate University Hospital infectious disease specialist, Dr. Stephen Thomas. Dr. Thomas, thanks so much for joining us again. Appreciate it.
Hi, how are you?
Good. So we are going strictly off the data. That's what we always hear the governor say. We hear the county executive say that as well. I'm sure you do that as well. How's it look to you for phase 2?
Yeah, so it's kind of a mixed bag. On the one hand, we are still seeing transmission of SARS-CoV-2, which is the virus that causes COVID-19. We're still seeing transmission. We are still seeing people being admitted to the hospital with significant disease. But at the same time, we're seeing some trends which leave me, cautiously optimistic. So the number of people each day that we're admitting to the hospital with COVID is becoming less. The number of total patients we have in the hospital with COVID is also slowly trending downwards. And the number of severe cases that we have in the hospital, so people on ventilators, for example, that number also seems to be trending down. So it's kind of a mixed bag.
So phase 1, we generously cracked the valve. Phase 2, we're really going to be able to test the virus here, I guess. As an average person, though, no matter how much the economy, society reopens around us, how much should we personally be testing the virus? I mean, is it okay to have these small barbecues? Can we go see our older parents? Should we be setting up play dates for our kids?
Yeah, so, I still have the same opinion as when we spoke last time. So I think that, first of all, you have to commit to doing this very slow, whatever it is that you're going to do in terms of reducing your physical distancing posture. So I think you need to go slow. The second thing is I think you need to be very smart. You need to know who it is that you're gathering with. You need to know what their risk factors might be, that if in fact they do get infected, that they may have a bad outcome. Or you need to understand whether or not they may be somebody who's at high risk of being infected and transmitting it to you. And so I think you stick with people you keep the numbers low. So this is not a time to have a couple dozen people over to your house. They throw numbers out like, 5 and 10 people. I'm not going to give you a number. I would just say that the number should be as low as possible. And then the last thing is I would not take any unnecessary risks. And, as it relates to, children, in the beginning, we did not think that children, we knew they could be infected. We knew they could probably transmit to other people, but we didn't think that they were going to suffer significant ramifications from infection. But that story has changed a little bit with this multi-system inflammatory disease that we've seen in kids. And so when people think about whether they're going to have play dates or not, don't just think about it as the risk that the children may pose to other people, but the children have a risk as well. So I would apply those same kind of ideas. Go very slow, be smart, know who you're gathering with, and keep the numbers low.
I saw a CNN report that seems to say there's some evidence that COVID-19 is related to prolonged time of exposure. So maybe passing somebody in a store is not quite as concerning as, like we're talking about, hanging out with a group of people. Is that what you're seeing, or?
Yeah, I think that makes sense, and it makes sense for lots of infectious diseases, and especially diseases that are transmitted through respiratory droplets. So it's how close are you to that infected person, and for what duration of time are you in the proximity of that infected person? And so, if you're outside and you walk by somebody inadvertently and no one has a mask on, I think that's probably a very low risk situation. Joggers, I think that's a very low risk situation. But being within 6 feet of someone for more than 10 minutes, then the risk starts to increase a bit. I will say, for context, in the hospital, it is impossible for us to physically distance in many occasions as we team to take care of patients. But we've had very, very few infections among our 11,000 employees that can be attributed to an in-hospital exposure because of the simple things that we do to protect ourselves, in terms of everyone wearing the ear loop mask, washing your hands, not coming to work if you're sick. Numbers
are always true, we know that, but how you read them, I guess, can be interpreted differently by people. So we're doing so much testing in the state, in the region, that our percentage of people testing positive is lower because we're testing so many people. But does that actually mean any less people are testing positive?
Yeah, so, I can just speak for upstate. We've done over 7,100 tests, and about 5.5% of them have been positive. In terms of antibody tests, we've done just over 400, and about 4.5% of those are positive. So, whether those tests were done in sort of a random fashion or not, and whether they truly represent what's out in the community, I'm not sure. I don't know. But again, I would just bring us back to again, the iceberg phenomenon, that there are probably a lot of people who were infected that did not get tested. And they didn't get tested either because they didn't have any symptoms, or they had symptoms and they were so mild that they didn't even need to come and see the doctor to be tested. So is that percentage going to be higher? Perhaps, but I think, I'm not surprised that we're probably around 5%, just because of how central New York is situated, the number of people per, in the geographic area that we are here.
I'm always going to ask you one last question before you go. I've asked you before, I'm going to ask you this one again. Anything different that we have learned about this virus? Is there the warm weather? Is that helping tamp it down? Is it any less contagious, any less powerful? Is this thing just like a really bad flu, or is it still the same virus that we saw when it got here in early March?
Well, it's definitely not a really bad flu, right? I mean, it's more contagious than influenza, and it's more deadly than influenza. I mean, on a bad flu season, we'll have about 40,000 deaths in the United States, and obviously we're unfortunately creeping up to about 100,000 deaths. I think we're just over 98,000 right now. Part of that is probably because the population was, there was no immunity within the population at all, because this is a new disease to humans over the past, 5 or 6 months. It's also not like the influenza, at least that I see, because it's really causing lots of problems in many organs that we don't always see with influenza. So people are developing clots. People are developing acute kidney injuries and needing dialysis. We're seeing this multi-system inflammatory syndrome in kids. We're seeing very young people having strokes, and so it's definitely not, and it should not be thought of as equivalent to influenza. It's an entity in and of itself, and it can be very severe.
Like usual, Dr. Thomas, more questions than I have time on. We'll save these for the next time you join us again. Thanks so much for being with us. We really appreciate your time.